Everyone. Today we're going to talk to y'all about music therapy. You may be wondering, what's the main idea behind music therapy? Music therapy was designed for people who can't easily communicate. In music therapy, instead of communicating with words, people use a range of musical activities to communicate, like singing, playing instruments, improvising, songwriting, and listening to music. These activities promote communication and social skills like making eye contact, sharing attention, and taking turns, which are all essential for communicative competence. Some other music therapy techniques include drumming, singing, and vibroacoustic therapy. So we've all heard of the common techniques listed above, but what's that last one, vibroacoustic therapy? This type of therapy is a non-invasive technique that uses sound waves and vibrations to treat a client's symptoms and conditions. The device used can be a handheld device or a specialty furniture piece like a chair that both vibrates and releases sound. Another technique is taking a sound bath where no physical contact with vibration occurs, but instead the client is exposed to sounds from an array of musical instruments like tuning forks and singing bowls.
What would a music therapy session look like? You might be wondering, what does a music therapy session look like? Before we researched this topic, I wasn't so sure either. We went ahead and found a few videos that do a great job showing how music therapy is elicited. Each session looks different and can change based on the diagnosis of the client. We made sure to include a video of a typical session, which we'll show you now, but we also included a longer video of a one-on-one session that is individualized for a child with autism spectrum disorder.
When we first started 4 years ago, Aiden was a member.
You know your ABCs?
Now he's putting 5 and 6 word sentences together. One thing with having a deaf child is they said music is going to be harder for him. And here we've had to buy several drums.
All of them that are here today, they have a need in articulation or expressive language, receptive language. All of them are here for either speech and hearing needs. I am working with 6 preschoolers each day. There's 2 different groups. I'm working collaboratively with the speech and language pathology students, grad students. I'm in charge of the music time. We're working with peer interaction and have them like repeat after me. And so they don't even know that they're practicing their, T sound or S sound. Music has this special way of reaching parts of people that other therapies cannot. Seeing how they've actually like really grown and like even in a week and a half that we've had them so far.
The closest program for Aiden with a cochlear implant is 3 hours ago. I'm very thankful Rockford has a program like this.
Working with the kids has been really fulfilling. That's been a lot of fun.
Hey everyone.
How does music therapy make a difference for individuals with ASD? To begin, music therapy enhances one's quality of life, involving relationships between a qualified music therapist and individual, one individual and another, the individual and his or her family, and music and the participants. Literature reports that most individuals with ASD respond positively to music. They often show a heightened interest and response to music, making it a great therapeutic tool for them. This therapy is so important because music therapists are able to meet the individual at their own level and have them grow from there. Music therapy is used to address behavioral, social, psychological, communicative, physical, sensory motor, and/or cognitive functioning. The structure and sensory input inherent in music help to establish response and role expectations, positive interactions, and organization.
Evidence-based practice. Evidence-based practice in music therapy involves integrating the best available tools from 3 key areas: research evidence, clinical expertise, and client preferences. Music therapy is built upon using peer-reviewed studies that demonstrate the effectiveness of various techniques in treating different conditions. An example is linked here in the study from PubMed. Therapists use their clinical training and experience to select appropriate interventions using techniques like active music making or receptive music listening to meet client needs. Lastly, involving clients in the decision-making process is also very important because their preferences help to shape the therapy through trust and a stronger therapeutic relationship. A few examples of evidence-based music therapy approaches include the neurological music therapy, NMT, which aids rehabilitation for individuals with brain injuries or neurological conditions, and guided imagery in music, GIM, is a psychotherapeutic technique used to explore the emotional experiences. Both techniques show the importance of integrating research, expertise, and client-centered care in effective treatment.
You might be wondering where and when music therapy could take place. Music therapy could occur in a variety of settings such as schools, clinics, music centers, daycares, or even right in the home. Music therapy is most beneficial during early intervention, but especially before age 5. So there's two types of people who can administer music therapy: registered music therapists and speech therapists. To become a registered music therapist, you must obtain a bachelor's degree or higher from a university approved by the American Music Therapy Association. Next, you must take and pass the National Board Certification exam. This allows you to obtain the credential MTBC. Speech therapists often incorporate aspects of music therapy into their sessions as a tool, but really should not be using that as their main session. How can AAC be incorporated into music therapy? Well, we're glad you asked. There are really a lot of unique ways to explore AAC with music. There are several ways to practice functional communication, such as labeling instruments on a device, requesting a favorite song, or practicing turn taking when finishing a song or rhyme. Music is really a good way to allow communication skills practice in a natural environment since most children will hear music everywhere, and it's usually highly motivating.
Therapy techniques used in music therapy. The music therapist utilizes various musical elements, such as rhythm, melody, harmony, and lyrics, to engage the individual and facilitate therapeutic outcomes. Music therapy can include many activities, such as listening to music, singing, playing musical instruments, composing music, and dancing. This provides a safe and supportive environment for autistic individuals to express themselves, explore new ways of communication, develop social skills, and manage sensory sensitivities. Music therapy can also help individuals collaborate well with others. They can learn to take turns, collaborate on music activities, and listen or respond to others. And this is our works cited page.